a lower socioeconomic status. People have lower education, live in poorer housing, have lower information level, they have poorer health. The ones that have higher education, they have a greater health. We see disparities in health. People who have lower socioeconomic levels, or people who have languages that are not common to where they live in, those are people who seem to have health disparities. So there's linguistic barriers, different care-seeking behaviors, and genetic predispositions, and local environmental conditions. And what we have seen, especially in the US and also in the UK, is racism has been found to be a determinant of health. Less tests have been done on people of minority groups, later treatment started, later diagnosis, a greater disease or morbidity and greater mortality in minorities, and increased risk for cardiovascular disease. And recently we've found, especially with researchers in Harvard, that racism in itself can cause cardiovascular disease, endothelial disease, which is the cells that line the blood vessels. They become inflamed with chronic stress and chronic racism in itself. That type of behavior chronically affects the health of a person and affects the way the health system treats the person, and ultimately, very sadly, their outcome. And so we go back to the original statement. 80% of all deaths are attributed to just 3 factors: tobacco use, poor diet, and lack of physical exercise. And we will go into detail into some of these health behaviors throughout the coming days so that we can get a better understanding of how we can improve and make adjustments to our health.